welcome back to the channel. Dr. Gene Shirakarad here. Corey and I are getting ready to play a round of golf here at Fairway Hills, one of our home courses here in Columbia, Maryland. But I'm dealing with some low back pain, and I know this happens to you a lot. It's one of the most common, if not the most common, issue for golfers and just for people in general, low back pain. But back pain, particularly low back pain, doesn't always present like we think it is right in the back. Sometimes you feel it as referral pain that radiates into the glute or pelvic region, sometimes in the leg. So it kind of happens in different ways. And it's really unique in the golf swing because you have so much torque and you have so much movement that can affect you on the golf course. So over the next several videos, we're going to break it down into 3 videos and help you play with back pain. Sometimes it's not realistic to wait until back pain goes away, but for most instances, or in many instances, as long as you get medically cleared, you can actually play with some level of back pain. And in these videos, we're going to show you exactly how to do that. So in this video, video 1, we're going to talk about how to get back pain down right before a round. In video 2, we're going to talk about what happens if your back starts hurting during a round or gets worse during a round. And in video 3, we're going to go over what to do after a round to make sure the back pain doesn't persist and what to do to actually prevent it and build up and then start to lower that back pain as you go. So let's talk about what to do before you tee off in this video. Alrighty, so best thing to do is sport-specific movement. Kind of prime your nervous system, prime your body for it. But you should also know what your body's feeling like before you tee off the first time. So too often we get to the golf course, we're running out, throwing our clubs in, and teeing off in 5 minutes. Not only are we not warming up, we're not having an opportunity to gauge how our body's feeling in the moment. So number 1 is go through the motions you're about to do. So right now I have my mini driver, and I'm going to start with locking down my upper body. I'm going to hinge a little bit, and then I'm going to move through the patterns nice and slow that I'm going to do in the biggest swing that I'm going to have, which is teeing off with a driver or a wood. So what I'm trying to gauge right now is going slowly, not to blow past anything, what my body's telling me. And what I'm feeling is as I'm coming through, that's when I'm feeling my symptoms, which is right in this area, which is one of the most common referral patterns for L4-5 back issues. So what I want to gauge now as I keep doing this is, does it change? Do those symptoms change? Meaning, are they getting better? Are they getting worse? And that's going to dictate a lot of what my body's going to do on the golf course. So I'm starting to go a little bit faster as my body's kind of getting warmed up and primed, and it's actually getting better. It's feeling less sore, less intense, less bruisey there, which is a good sign for me. So then I want to go a little bit faster. Until, let's say, it's about 85% better than when I started. Now stopping, I can start to feel it again, tightening up a little bit, but I'm okay with that because it's starting to subside right away. But this way you at least know what to expect, prime that body, so it's no surprise to you when you're on the golf course teeing off. So that's number 1. Number 2, it's load up that tissue. So we do want to work it a little bit. And one of my favorite things to do is work kind of that tilt a little bit. So here, I'm going to put the golf club down. I'm going to take 1 foot off the ground, and I'm going to drop my pelvis and bring it up. Drop my pelvis and bring it up. It kind of creates that pelvic tilt and shearing, which really challenges your pelvis and your low back and kind of gets it really ready for very similar motions in the golf swing, because there is a lot of tilting. If you have a good golf swing, so, you should have some tilting, but this really gets it going. And this is a motion we don't often do or ignore, that doesn't get talked about, this pelvic tilt. And I would do both sides to get that pelvis ready, because it is kind of the fulcrum in the golf swing. Yes, you need upper body a lot. Yes, you need your shoulders and shoulder mobility and thoracic mobility and hip mobility. But by getting the pelvis warmed up in that plane really helps you with the golf swing and starts to bring your pain level down before you tee off. So those are 2 very simple, easy things you can do before warming up on the driving range, which I strongly encourage if you're dealing with back pain. Try those out, see how they work out for you. We got 2 more videos coming, so make sure you subscribe, follow along, and you'll see those videos coming up pretty shortly. Thanks for tuning in. Good luck out there.